ZUMA-9 is really an expanded access protocol. And what it does is it allows for patients who are apheresed with intention to get axi-cel as a commercial product for the treatment of relapsed refractory diffuse large B-cell lymphoma. However, at the end of manufacturing of their product didn't meet the approved specifications by the regulatory bodies. And typically that's either because the viability of the cells wasn't quite to the percent that was expected, or the interferon gamma release criteria, the amount of interferon released upon exposure to a CD19 target wasn't within the expected range. And so rather than these patients just not being able to get axi-cel, they enrolled onto this ZUMA-9 expanded access protocol whereby they didn't, it wasn't given as a commercial product, it was given on trial. And so it's still testing axi-cel, but it's just not within the regulatory approved, FDA approved specifications. And interestingly, what we found in these patients is that they still could have responses and meaningful clinical benefits with this sort of out-of-spec product, as we call it. However, we did find that the expansion of the out-of-spec axi-cel within the patient was a little bit lower than what we saw in the ZUMA-1 clinical trial. And there was a slightly lower complete response rate than in the ZUMA-1 trial. And if you look, when we look at the phenotype of the product, there was a little bit more skewing towards an effector phenotype, or a more differentiated product than ZUMA-1, which goes in line with this decreased expansion after infusion into the patients. And so I think more study is needed, but it appears that these products were slightly more differentiated in their phenotype, and they don't expand quite as well after infusion into the patients. However, these patients still were able to obtain complete responses. In the expanded access ZUMA-9 protocol, we were finding an objective overall response rate of 53% and a 36% complete response rate in the patients who had that out-of-spec product. However, we don't have enough follow-up yet to reach the median overall survival for these patients, and the 12-month overall survival is 62%. So clearly these patients can have responses and durable responses to these out-of-spec products. And we really don't want to shortchange these patients by not allowing them access to the products that are slightly out of specification.